Good afternoon, everybody. Good afternoon. Deputy Secretary Smith, good afternoon. It's good to see you. I'm Dr. Val Arkoosh. I have the honor of serving as the Secretary of the Pennsylvania Department of Human Services. And I want to thank all of you for joining us today as we recognize Suicide Prevention Awareness Month here in the Capitol. I especially want to thank Governor Shapiro and Shapiro administration leadership from the Departments of Military and Veterans Affairs, Aging, and Agriculture who are joining me here today, and you'll be hearing from all of them shortly. We also have our agencies and additional organizations around the rotunda to provide information and resources on suicide prevention, including information specific to those we serve and to those who are most at risk for suicide, including veterans, older Pennsylvanians, members of the LGBTQ+ community, and so many others. And learning about this information and learning what resources are available is so important because you just never know when someone might decide that you are the person that they're going to confide in, or that you're the person that they feel safe sharing some information with. And if you know what to do next, that could make all the difference in the world for that particular individual. Today is about honoring survivors, remembering those that we have lost to suicide, and crucially, talking about these resources available to help those in crisis. Thoughts of suicide, self-harm, and behavioral health challenges are more common than many people realize. They can happen to an individual of any background or social identity, in any zip code, or at any income level. And they may be hard to spot. Think of the happiest person that you know. They may seem like everything is great, but you never really know what's going on inside. And we always want to be alert and attentive and able to respond when there is that sign that someone could use a little bit of help. According to the latest data from the Pennsylvania Department of Health, 1,976 people died by suicide in Pennsylvania in 2023. It goes without saying that this is an unacceptably high number. But even one life lost to suicide is one too many. And of course, these numbers are not just statistics. They represent real people whose deaths have ripple effects throughout their families and throughout their communities. We know that survivors and loved ones affected by suicide may wrestle with unanswerable questions, complex emotions, and probably hardest of all in some cases, fears of being stigmatized and isolated if others knew how their loved one passed away. And so they don't share, they don't feel safe in sharing that information, and that only adds to the loss. As part of our event today, we want to uplift communities that often face greater risk of thoughts of suicide. You will hear directly from people who work every day to advocate for their peers and their community and their personal connection to this work. And one of those people is our Deputy Secretary of OMSAS, Jen Smith, and I just want to acknowledge her and give her and her team a big round of applause. Thank you, Jen. There is strength in sharing, and we are deeply grateful to have individuals here with us who are graciously willing to share their personal experiences, to help raise awareness, and to honor those who we have lost by suicide. Each of these individuals will be introduced by a member of the Shapiro administration to represent our support of them and their story. But before they come up to speak, let's talk just for a minute about what each of us can do to help ourselves, our neighbors, our friends, and our loved ones. First, lead by example. When we talk about our mental health and what we feel and experience and check in with our loved ones, we can help people other people feel safe about also sharing how they feel and what's going on in their minds and how they might feel more comfortable reaching out for help. And as a community, as a society, we must commit to asking for help for a mental health challenge or a substance use disorder just as easy and stigma-free as you would ask for help if you broke your arm. There should be no difference. But we all know that there is. And it's about all of us. It's about every Pennsylvanian spreading the message that there should be no difference. These issues are just as important and just as real as any physical abnormality like breaking your arm. So we want to make asking for help as judgment-free as possible. Right here in Pennsylvania, we are off to a really good start. We have 14 suicide and crisis lifeline call centers where trained staff answer calls when you call or text 988. When you call or text 988, you receive free and confidential help 24/7. You're connected to a caring and highly trained staff person who will listen, provide support, and refer you to resources in your community as needed. If you are a veteran and choose to identify as a veteran, you will be immediately connected to services specific for veterans. You will get no judgment, just help. The Shapiro administration is so grateful for the dedication of the staff and volunteers at call centers across the Commonwealth who are there to support our fellow Pennsylvanians. In Pennsylvania, in just August alone, August of 2025, the 988 call centers took more than 11,000 calls and 7,000 chats in 1 month. 11,000 calls, 7,000 chats. And more than 90% of those callers' issues were handled over the phone or through the text, just by having a chance to say something out loud or through a text message. There was no need to deploy EMS or any other kind of crisis services. 90% just handled right through 988. This data shows how important services like this are and the tremendous and potentially life-saving impact of simply having someone who's immediately available to listen. I'm proud to be part of this administration with Governor Shapiro prioritizing support for this life-saving work through increased funding for behavioral health services throughout the Commonwealth. Now, to share more about what Pennsylvania is doing to prevent suicide and reduce stigma for veterans, please welcome Major Jenry Tara Kudelka, the Deputy Adjutant General Air from the Department of Military and Veterans Affairs.
Thank you, Doctor, and thank you to you and your team for inviting us to this special event and an important event, obviously. Good afternoon, everyone, and thank you for joining us. Each day across America, we lose too many of our veterans to suicide, a heartbreaking reality that affects families, communities, and our nation as a whole. On average, 17 veterans die by suicide every single day. A stark reminder of the mental health challenges faced by those who have served our country. It's a crisis that demands our urgent attention, compassion, and action. The Department of Military and Veterans Affairs is deeply committed to raising awareness about this issue and providing vital resources and support to our veterans and their families. Through outreach, education, community partnerships, we work tirelessly to reduce stigma, promote mental wellness, and prevent veteran suicide. That's why public events like this are essential. They not only educate the community, but also foster connection, understanding, and hope. By coming together, we break the silence, reduce stigma, and remind every veteran that they are not alone. Today, we are honored to have James Stafford with us, a veteran who bravely shares his own story of struggling with suicide ideations. James' experience offers us a powerful perspective on the challenges many veterans face and the hope that comes with seeking help and healing. Please join me in welcoming James, and his story reminds us all why this work matters and is deeply important. James.
Good afternoon, everyone. Thank you, General. Thank you, Dr. Arkoosh. Thanks for everyone for being here. Once again, I'm James Stafford. I served in the Army National Guard from '99 to 2007, and I have a lived experience with suicide. And as I was preparing my speech to talk about my lived experience, I really wanted to talk about parts of that. After my time in Iraq, and my experience happened while I was still in boots, I was still in the service, and interestingly enough, or maybe not, I was home on leave. Life was going really well, and at that time, I had what I didn't know was a panic attack. And that kind of set my body, my mind in a direction that I had no knowledge that it could go into. I didn't know what was going on. I felt crazy at that time. Every single thing, every feeling, every experience happened at the same time. And I worked through it, but through other circumstances, I find myself in a hotel room and having this experience again, and didn't know what to do with it, and I didn't think I had other choices. But I'm not here to talk about that part, it's the after. And it's one of the things I think when I look back and reflect and take an inventory of myself as I continue to do the work. With trauma, most people know that your senses are involved with your trauma. The one thing that I never really took into account was how quiet it was, the silence. How I'm in a room by myself in a big city, all these things going on, and just felt so quiet and alone. And even after, I began to seek help, after I began to, find the tools to get help and become, a new me, it was always quiet, which continued, the trauma. I was afraid to go to sleep. I hid in the things we call success. I'm going to go back to school. I'm going to go to work. I'm going to, be engaging with people. I'm going to do these things with my kids, walk my dog, all to keep it as loud as I can, so I can so I don't have to go back to that silence, because I wasn't sharing. Someone recently once shared with me, secrets keep you sick, and that was my secret. Even though I looked like I was doing the work, I looked okay. I looked, sound, felt like, everything was going right. I wasn't, because I was scared to say out loud, what was going on with me, that stigma. People see me, even now, I look okay. But even then, they think this big tough guy served in the military, he's doing all these things, but those things can betray you. And I know there's lots of folks you hear about suicides, you hear about someone going into a hospital or having being in this crisis, and you say, we never saw it coming. Oh, we didn't see the signs. Sometimes the signs are in front of you because they're in silence. If a picture is worth 1,000 words, a moment of silence is worth 1,000 lifetimes. What happens in the silence when you're not sharing that can destroy you, can destroy families, and even right here in front of you every day at work, because we can't count the silence. We can't measure that. We can't figure out what's going on. All around us in this room is a fraction of the resources available to the citizens here in Pennsylvania. Funded many different ways, but if there's silence, those resources may never be used. And as someone that tried to use the system, and it failed me in some ways, and I failed myself in some ways. I think as a veteran, there are many sayings about veterans, but veterans never forget, and veterans never forgive. And that applies to the veteran themselves. How can I forgive myself? I can't forget those things, but when I started to share my story, when I started to talk openly about, my attempt, talk openly about, people see me this big, but I felt this small in that silence and in that darkness, people say, I felt that way too. I understand that. And you don't have to look like me. We don't have to live in the same space. We don't have to even share the experience that we serve, but there are things that we can do for one another just by breaking the silence, by sharing. And that helped me feel like I was together with someone. Just like and I think that's really what I want to say to everyone is we have to be together by helping someone come out of the silence. And it looks different. There are so many, I never claimed to be, a psychiatrist, or push these inventories to help folks get the framework and the tools. They benefited me, don't get me wrong, but I found a lot of my help gardening, doing a brief experience in horticultural therapy. And in that moment in the dirt, kind of feeling like, I feel connected, taking that with me at home. And when I'm in the silence at dark at night and I can't sleep, I'm outside, chasing a snail, literally, and find myself putting all of my mind and might into this and, finding hope there in the ground. That worked for me. And true story, I went to sleep for the first time, and I wasn't afraid of my thoughts. It helped me unpack, and that's just how it looked for me. Those opportunities should be available. Those should be doors that we all together try to help form because they benefit us. And that comes from working together with the legislative body, working together, the state system and their departments all working together. All of us working together to create those environments where there's no wrong door. 988 is a fantastic resource, but it's just the tip of the iceberg. I'm on the PA Vet Connect team for the DMVA, and I pride myself in those little minutiae. You may come for us for the steak, but I'm all about the potatoes, because that's good too. That's what you'll get there, and those resources look different. They should feel different because we're all different, but we are all together. So I hope my lived experience I used for a way for folks to think about being together, having hope together, and being well together. Thank you.
Thank you, James. And I don't know if any of you know James, but he is just always so willing to share his story, and we are all the better for it. So, James, thank you so much, and for being willing to, over and over again, share your journey and your journey of success. So thank you. Okay, now I would like to welcome Deputy Secretary Jonathan Bowman from the Department of Aging.
Good afternoon, everyone. Thank you, Secretary Arkoosh, other agencies, and thank you, James, for sharing. Very much appreciated. From the department, really appreciate this opportunity to be here for our department and the Aging Network to talk about suicide among older adults, which is a serious and growing community health problem. One of the myths about suicide is that it is a mental health issue only impacting younger populations. While suicide is closely linked to mental health and substance abuse, older adults particularly face the risk factors of loss, isolation, and chronic illness. Men age 65 and older are at particular risk. If an older adult is experiencing social isolation, loneliness, or depression, we encourage them to reach out to their local area agency on aging, call 988, or speak with a friend or loved one to get connected to the help they need. I am accompanied here today by two leaders from Pennsylvania's Aging Network, Karen Leonovich, Director of Policy and Programs, Pennsylvania Association of Area Agencies on Aging, and Allison Tebus, Director, Perry County Area Agency on Aging. Pennsylvania's Aging Network is made up of 52 area agencies on aging, which serves thousands of Pennsylvanians every day, providing meals, in-home services, protecting older adults from abuse, and much more. Karen and Allison know their communities, and they have seen firsthand the impact that suicide among older adults has on families. On behalf of the Department of Aging, I would like to thank Karen and Allison for traveling here today to share their perspectives and their personal stories. Karen and Allison.
Good afternoon, and thank you for joining us for this important discussion on suicide prevention awareness, especially amongst the older adult population. Suicide among older adults is a growing public health concern. According to the Pennsylvania Older Adult Suicide Prevention Work Group, nearly 1/4 of all suicides in 2023 were older adults. That's an average of just over one older adult suicide every single day, with men making up about 85% of those deaths. Between 2019 and 2023, Pennsylvania did report over 2,000 suicides of individuals 65 and older. Those numbers represent not just statistics, but parents, grandparents, neighbors, and our friends. Understanding the risk factors is essential. Older adults may have faced challenges that heighten their vulnerability, including a history of depression or other mental health conditions, serious illness or chronic pain, which can diminish the quality of life, loss of autonomy and self-sufficiency, leading to frustration and hopelessness, a sense of being a burden to their family or to their caregivers, loss of relationships, whether through death, relocation, or other estrangements, social isolation, which can magnify feelings of loneliness and despair. Recognizing these warning signs can give families and communities an opportunity to intervene before a crisis occurs. For me, it's not just data, it is personal. My grandfather died by suicide at age 67. He had a long history of chronic depression and vision impairment. I was only 17 years old when he passed away. Looking back, there were warning signs, but at that time, we did not recognize them. One of them, he began to repeatedly apologize to my grandmother, kind of out of the blue, for various issues throughout their marriage. This, again, was not a typical behavior for him. He visited several of his loved ones frequently and expressed his love and appreciation every time he left. He reviewed his personal documents, making sure everything was in order, and he began sleeping longer and lost interest in his lifelong hobbies. My family often wishes we had known what these signs meant. Awareness might have given us a chance to intervene earlier. That's why events like this are so important. Suicide prevention starts with awareness, learning to recognize warning signs, reducing stigma around mental health, and reaching out to at-risk individuals can truly save lives. If you're concerned about an older adult or anyone, don't hesitate to check in and ask questions and connect with them for various resources. Together, we can build stronger support systems for our older adults and prevent future tragedies. Thank you for being here today and for taking the time to learn about suicide prevention and awareness. By increasing awareness and compassion, we honor the lives lost, including my grandfather's, and we give hope to those who may be struggling. And thank you. I'll hand it over to Allison.
Good afternoon, everyone, and thank you for being here today. And thank you to the Department of Human Services and the Department of Aging for this opportunity to speak during Suicide Prevention Awareness Month. This is a time to shed light on a topic that too often remains in the shadows, a time to remember those we've lost, support those who are struggling, and reaffirm our commitment to building a world where hope is stronger than despair. Every year, millions of people around the globe battle with thoughts of suicide. These are just not statistics. They are our friends, our family members, our classmates, our coworkers. They are people who may feel invisible, overwhelmed, or alone. But the truth is, you are not alone, and your life matters. In September 2023, I lost my grandfather to suicide at the age of 77, the day before his 78th birthday. At his service, I promised to do my part to educate and bring awareness to mental health and suicide prevention by sharing his story. My grandfather rarely showed his emotions. He was raised on a farm and taught that showing emotions was a sign of weakness. At 14, he lost his father to a farming accident, and as the oldest, he took on many responsibilities. After his retirement, I interviewed him for one of my social work courses, and he told me that losing his father had been one of the most impactful events of his life, although he never really thought about it or realized the impact until our discussion. This was only one of 2 times I had experienced my grandfather showing emotions and vulnerability. Looking back, there were signs that we overlooked or easily excused, especially after his retirement. He slowly withdrew from socializing and started spending most of his time in his room, either online or watching TV. We attributed to he had nothing to do and was bored. He and my grandmother, who never argued, started bickering more often, which we attributed to them being around each other more often. And at one of his doctor's appointments, he mentioned answering his depression screening questions, but later called the doctor's office to change his answers due to fear of what would happen if someone thought he was depressed. I truly believe that the lack of open discussion surrounding mental health, mental illness, and cognitive decline perpetrates stigma and misunderstanding. Mental health encompasses our emotional, psychological, and social well-being, affecting how we think, feel, act, handle stress, relate to others, and make choices. Mental illness are among the most common health conditions, with more than 1 in 5 adults in this country living with one. One of the challenging aspects of mental illness or cognitive decline is that, unlike many physical illnesses, they are often not outwardly visible. However, just like most physical illnesses and declines, mental illness and cognitive declines are treatable. My family has struggled and continues to struggle with many questions and emotions. We often wrestle with the what-if scenarios. If only I had said something, if only I had done something, if only I had noticed what he was struggling with. We also grapple with the whys. Why did he do this? Why did he make this decision? However, this path leads nowhere and provides no answers. Even if we knew the reason, the underlying riddle would remain. As we struggle with our questions and feelings of inadequacy, we are overcome with many emotions, feeling as though we might have failed him. Although we do not know the circumstances surrounding our pap's passing, we all know that this was not his character for much of his life. It could have been burdens, anxiety, failures, or unresolved guilt of which we had no knowledge. It could have been a chemical imbalance that for a period of time caused reason to be replaced, mental control to be lost, and judgment and stronger sense of pursuing life to be snapped. We must sadly admit that our family is now among others who have experienced such a loss. We need to do our part to change this by being non-judgmental, compassionate, and understanding with others. We must break the silence and the stigma. Talking about mental health is not a weakness, it's a strength. Asking for help is not a burden, it's a brave step towards healing. And offering support doesn't require expertise, just compassion, presence, and the willingness to listen without judgment. If you are struggling, please know that there is help and there is hope. Reach out to a friend, a counselor, or a hotline. You are worthy of love, support, and a future. If you're someone who wants to help, start by being a safe place. Check in on your loved ones, learn the warning signs, share resources, speak up, because sometimes a simple "I'm here for you" can be life-saving. Today might be the last day of Suicide Prevention Awareness Month, but let's make every month a time of connection, understanding, and action. Together, we can create a world where no one feels like suicide is the only option, and together we can all save lives. Thank you.
Karen and Allison, thank you so much. Those were beautiful, beautiful words, and we are all so grateful that you were willing to share your personal stories, so thank you. Next, I would like to welcome Sarah Gligora from the Department of Agriculture's Workforce Specialist up to the podium.
Thank you, Secretary, and thank you all for being here today for the important conversation on mental health and suicide awareness. As we've heard and seen today, suicide and mental health impacts families and communities across the Commonwealth, including those in the agricultural community. I'm honored to be here today representing the Pennsylvania Department of Agriculture and honored to stand alongside so many dedicated individuals and organizations committed to breaking the silence around mental health. Farming is more than a livelihood, it's a way of life. But it's also a profession that comes with unique stressors, financial uncertainty, isolation, unpredictable weather, and long hours. These pressures can take a serious toll on the mental health of our farmers and rural families. That's why today's conversation matters so much. It's about listening, supporting, and reminding our communities that they are not alone. It's now my privilege to introduce someone who has long been a voice for Pennsylvania's rural communities, someone who understands the challenges firsthand and works tirelessly to advocate for the well-being of our farmers. Please join me in welcoming Matt Espenshade, dairy farmer and president of the Pennsylvania Steak Range.
Secretary Arkoosh, thank you for the invitation to be here today. Respectfully, I wish I didn't have to be at this gathering today. I wish none of us had to be at a gathering like this today. But the sad reality is that all of us need to be here at a gathering like this today. Because of the efforts of the people in this room, we can proudly say that finally a light is being shown into the darkness when it comes to the crisis that's facing America, and that's a rural health crisis, rural mental health crisis. We look across rural Pennsylvania. They're the heart and soul of our Commonwealth. The families that live there are engaged in farming and supporting practices. They're the salt of the earth type of people. They've been grown, over the generations, they've learned to be self-sufficient, depend on themselves to get themselves through. When they have challenges, they've been told to keep it to yourself, bottle it inside. And that's been prevalent for generations. That hasn't always been the best course of action. But because of the people in this room, and because of the work of others, an open dialogue is starting to finally happen across our state, where people can talk about their feelings. But rural communities still face an upwards challenge. Compared to their urban counterparts, people in our rural communities live in sort of isolation. They live with challenges that aren't being faced by people in urban areas, access to internet, and with that, the opportunity to participate in telemedicine. We look at our rural hospital situations, and they're shuttering at an alarming rate. And with it, those ancillary support structures where they can have the opportunity to talk with people about what's going on besides the causative effects of their health issues, but as far as what's really, really down deep at the heart. We look across at our rural spectrum, and we look at nationally 65% of rural communities, rural counties lack a psychiatrist. 81% lack a psychiatric nurse practitioner. 47% lack a psychologist. Without this support structure, without the opportunity to reach out and make these connections, people living in our rural communities face an uphill challenge. As was mentioned with farming, it's very much an industry where so many things that going on a daily basis are outside of your control. As was mentioned, weather and the markets, and just the overall challenges and the burdens. The farm that I operate today has been in the family since 1867, the 7th generation of our family to work and operate on the same farmland. With that comes, it's a tremendous honor, yes, but also a tremendous weight and responsibility, and not being the one generation that couldn't make it. That's something that we live with on a daily basis. We look forward to this opportunity to finally work together to raise the awareness of these challenges that are being faced in our rural communities. The Grange is an organization that advocates for for farming and agricultural issues in our rural communities. There's 170 local chapters located across our state. Each of these local Granges are a reflection of the communities that they serve. And through the Grange, people are finding the opportunity to work for the betterment of their communities. And that's one of the things that we've learned over the years, is that if you're feeling challenged inside, one of the best things you can do is get out and help another person. Start to work together to elevate all of your people in your community. We face a lot of challenges. A lot of them come from social media, where our youth are looking at Facebook and Instagram and posts and watching the highlight reels of other people while they're just dealing inside with the mundane tasks of day-to-day life. People are very selective with what they share online, and when you compare it, a lot of times their lives just don't seem to add up. I know I face that challenge as well too. The National Grange has partnered with an organization called Rural Minds, and together we're launching an initiative called the Rural Suicide Awareness and Prevention Program. This is going to develop peer-to-peer communications. We're going to find ways to give this next generation of youth the opportunity to be trained and to be keenly aware of the signs when they talk to their friends. They're not going to be the ones that solve the problems, but be able to pick up on the signs, those help signals that people are asking for when they talk to each other. Sometimes they get missed. But in doing so, share with that person where they can go for help, how to reach out for help, and for them to realize that they're not in this alone. There's opportunities to seek help and find ways to work together to find a solution for the challenges that they face. I want to thank the Shapiro administration and all the organizations that are here today. Together, we are working together to raise awareness. And in doing so, this liberates people living under this cloud of stigma of that rural mental health is something to be kept within. The work that you're all doing is allowing there to be a conversation opened, allowing them to know that there is an opportunity to seek help and to talk openly, finally, about the challenges that they're facing. I would also call on the youth of Pennsylvania that are trying to decide a career path. Perhaps this is one for you to look into. These people that are facing these challenges are going to need trained and skilled people to talk to. This would be a tremendous opportunity to really make an impact on someone's life and the communities that they serve in. Again, I want to thank you for this opportunity to speak with you today, and we deeply appreciate the work that we're all doing together to raise awareness and that life is worth living. Thank you again.
So well said. Thank you so much. Matt, thank you so much, and for being such an authentic voice, lifting up the needs in our rural community. And we are also grateful for the work that the Granges are doing across the Commonwealth. And I'm going to underline your call for workforce. I think in every community, when people are seeking help with issues of this type, they want to feel comfortable with the people that they're talking with, and people want to meet people from their communities. And we have a huge shortage of professionals that work in behavioral health in our rural communities in particular. So thank you for lifting that up, and we're so grateful that you could be with us here today. Next, I'd like to introduce Casey Pick from the Trevor Project. If you don't know the Trevor Project, you should. They are a leading suicide prevention organization for LGBTQ+ young people.
Thank you, Secretary Arkoosh. Hi, everyone. My name is Casey Pick. I use she and her pronouns, and I have led policy and advocacy initiatives at the Trevor Project for the past 7 years. As noted, the Trevor Project is the leading suicide prevention and crisis intervention organization for lesbian, gay, bisexual, transgender, queer, and questioning young people. We operate 24/7 crisis services so that young people can reach our trained counselors via phone, text, or chat anytime they need support. We also offer a number of programs focused on prevention, including our research, advocacy, and education programs. For nearly 3 decades, our team at the Trevor Project has been working toward our mission of ending suicide among LGBTQ+ youth. Because this high-risk group of young people is more than 4 times as likely to attempt suicide compared to their peers. Our research estimates that 1.8 million LGBTQ+ young people seriously consider suicide each year in the United States. That's more than the entire population of Philadelphia. Imagine the entire city of Philly, full of young people struggling with thoughts of suicide. And I want to be clear, those elevated rates of suicidal thinking, it has nothing to do with who these young people are. It's not because of their sexual orientation or their gender identity, but because of what they experience living in our society. The elevated rates of discrimination, violence, homelessness, being treated like an issue to be debated rather than a person to be embraced. That is our reality in this country each and every year. And as we wrap up Suicide Prevention Awareness Month, we must commit to ensuring that those placed at highest risk for suicide, including LGBTQ+ youth, receive the attention, intervention, and support they need to see a brighter tomorrow. As most of you likely know, this summer, the administration abruptly ended federal suicide prevention services for LGBTQ+ youth by shutting down the 988 Lifeline Press 3 option on July 17th. This was a devastating blow to our efforts to support LGBTQ+ youth in crisis and created a major gap in care for the more than 1.5 million LGBTQ youth who relied on 988's Press 3 option for life-saving services. Despite this setback, I remain hopeful for the future of LGBTQ+ youth and for our efforts to end suicide among this group. The resilience of our community, the strength of our allies, partners, and supporters is simply unmatched. The Trevor Project's 24/7 crisis services remain available for LGBTQ+ youth today, just as they always have. And we have seen countless allies step up to support these youth in the wake of this news, including local and state officials here in Pennsylvania. Thank you to Secretary Arkoosh, to the Department of Human Services, and to everyone here today for dedicating your time and your attention to this important topic. It's not easy to talk about suicide, but the more we come together to destigmatize this public health crisis, the better off our future generations of young people will be, here in Pennsylvania, nationwide, and all across the globe. Thank you.
Thank you, Casey. We're so grateful to you and to the Trevor Project for providing these life-saving resources to this community. And just want to know you have a lot of allies in this room that are standing with you. I want to give a shout out to Ashley Strange. Ashley is the Executive Director of the Governor's Commission for LGBTQ Affairs. It's great to have you here too. I'm just going to touch a little bit more on this particular community because they've had a particularly difficult time these last few months. And I know that many in this community are unsure about support available given, as you've heard, actions at the federal level. But please know that here in Pennsylvania, our 988 call centers are working with the Trevor Project to provide training and resources so that the LGBTQ+ community here in Pennsylvania and their loved ones get the respect and the support that they deserve. I want to note that this was something that Governor Shapiro was particularly focused on, and I want all of you to know that all 14 of our 988 call centers stepped up. Folks were trained in every call center on how to respond to the needs of LGBTQ+ youth, and if the person who answers the 988 call or text doesn't feel fully equipped to answer those needs, they will provide a warm handoff to the Trevor Project's hotline, which is still up and running. And so they will literally get them on the phone with the other individual on the phone, make sure the connection is made, and then our person will step off. So I just want you to know that here in Pennsylvania, these services remain robust, and we have every intention of keeping them that way. I'd now like to welcome our last speaker, Stephen Sharp. He is co-leader of the Pennsylvania Black Youth Suicide Work Group, a nationally certified school suicide prevention specialist and a school counselor.
Thank you so much, Secretary. And I just want to say I'm really humbled to be here today, just to be following so many courageous people with both lived and living experiences and so many dedicated individuals to such important work. It's impossible to ignore the toll when it comes to suicide on our youth, particularly our most vulnerable youth, whether it be our LGBTQI youth, but our youth, our Black youth, and their communities. When we talk about just by the numbers, our students are telling us roughly 22% of our Black youth, the students sitting in front of them, behind them, the students sitting to the left or the right, or the student at the desk is across a year seriously contemplating suicide. 17% of those same students are going to make a plan. Of those students who act on a plan, over a third of them across a year are going to require medical attention. It's impossible to ignore these numbers, particularly when we look at the past 20 years at our own state numbers and realize that for our suicide rate for Black youth, it's grown by over 70%, while our white youth have died by, unfortunately, 14%, all which are tragic numbers, which are too much. So we need to ask ourselves, what can we do? Here in Pennsylvania, I feel very fortunate to be one of the co-leads for some very important work. The CDC issued a few years ago in 2019 a report followed by a congressional report ringing the alarm to the rising rate of Black youth suicide. And I'm here saying that we're answering that call here in Pennsylvania. When we talk about it, our work here in Pennsylvania started with the work group, some who are in attendance right now in Baltimore, working directly with SAMHSA to develop policy priorities and action plans to impact statewide. We had goals in data, unique community partnerships, bi-directional communication, our direct communication with our communities in that dialogue, and then in addition to that, empowering our youth in our communities and elevating youth leadership. What we understand is we had a chance to do a lot of interesting programs and projects to collect data and hear our youth with great, vibrant convenings with our youth, led by some of our most essential partners, including Lincoln University and Cheyney University, having their students facilitate these conversations with our K-12 students on their perceptions and their needs. And they have told us very clearly what those perceptions are when it comes to gaps in opportunity and access to treatment, barriers, but also they told us the things that they have, which is hope, which is, again, a lot of different things. It is the educators that they work with, their friends and families, their communities of faith, and so much more. But what also has been unique in our continued journey here is, frankly, something that's both alarming and encouraging. As we know, there have been a lot of changes in federal policy, and the federal support when it comes to Black youth suicide prevention has almost entirely disappeared. But here in Pennsylvania, we are unique amongst the 50 as we continue this work and we lead in this work. I want to celebrate that as we continue this meaningful work right now. So with the minutes and time I have left, I just want to take some minutes to really thank Secretary Arkoosh and all the different wide and varying members of our work groups, including the Department of Human Services, Department of Health, Department of Education, community-based partners, families, volunteers, and so much more doing this work across the years to transform the lives of our Black youth. And I also at this same point want to take some time to thank all of you out here today. Because what we understand is our pathways to care, they're built on foundations, networks like these, and communities based on compassion. So thank you to the Secretary, thank you to Governor Shapiro for this continued support, and we're looking forward to the work ahead. Thank you.
Thank you, Stephen. We're so grateful for your work. It's really inspiring. And you know, I just love hearing from all of you. We all know there's enormous challenges facing us from federal budget cuts, and yet everyone in this room is committed to carrying on, right? because this work is too important. And with Governor Shapiro and this administration, we will find a way forward because we absolutely have to. We know that lives are depending on this work. We know our communities are depending on this work. And after hearing all of you speaking today, I have full confidence that we will find a path forward no matter what the challenges are ahead of us. So I also want to thank a few more folks. In addition to our state agencies who are represented today, I also want to thank our partners at the Trevor Project and Hempfield School District for being here. I want to thank Prevent Suicide PA, the Jana Marie Foundation, AVDUM, the Suicide Prevention Alliance for joining us today. And as we wrap up today, and as you heard, today is the last day of Suicide Prevention Awareness Month, I just want to leave you with a few reminders that you can take with you as you work in your communities and with those that you care about that might just give you a little bit of extra assistance. So just keep checking on those loved ones, on your friends, on your neighbors, on your colleagues regularly. I think you heard from everyone today that sense of just reaching out, being there for someone if they need a friendly ear, and how important it is to be non-judgmental. I think we're always all looking for non-judgmental help when we ask for help. Just reminding them that you care and that you're there for them is simply enough. That is enough. That can make all the difference in the world for someone who just needs to know that somebody actually cares about them in this moment. And as a physician, I'm always compelled to say this out loud in public. Probably everybody in this room knows this, but so many people think that if they ask someone if they are thinking about committing suicide, that that is going to plant a seed or might lead them to do so. And I just want to make sure that people know that is absolutely not the case. In fact, it is just the opposite. Actually saying those words out loud. Are you thinking about harming yourself? Do you have a plan? And acknowledging that someone could be having those very real feelings might be just what they need to feel safe, to open up and share what is going on with them. I think that's something that we can all do in our communities, is to let people know asking if someone is thinking about self-harm is not going to lead them to do so. It is a significant misconception out there. If someone does want to talk, offer to sit with them while they call or text 988. You don't have to be the expert, but maybe just offer to sit beside them while they make the call or they send a text. And don't forget, 988, I know we all know that number, but there's lots of folks out there that still have not heard about 988. So whenever you have the opportunity to share that resource, please do so. So again, just thank you so much for being here with all of us today. I'm happy to take any questions, all of us, if there are any. And if there are any questions, I want to ask all the speakers to come up and we'll take a picture together. But first, are there any questions? Okay, then with that, we'll invite all the speakers up for a quick photo. Thank you, everybody.